Orthopedic surgery is a profession that I chose in my life because we actually do have an impact in making people somewhat better and allow them to move on with their life. But what one finds relatively quickly is what defines sports medicine. I had association with NHL teams, NFL teams, as well as all the professional teams that have been locally in our region. But that isn't the real gist of our practice. Although those elite athletes continue to play at levels that you and I would never be able to, it's your golf game or my weekend skiing that is equally important to me as any athlete would have for their profession. To be able to work in an occupation that allows people to return to a lifestyle or to a sport is important to me. Their lives are significantly negatively impacted when they see us, and those that we can return to a higher level of function, allow them to get back to their family or to their job or to their activities that they love is really what makes this job, I think, the most exciting and the most rewarding.
Most of what we do is everyday people, not professional athletes. We do a lot of work injuries tied to falls or injuries on the job that can interfere with functionality at work and at home. We have a lot of patients that are managed for chronic shoulder pain, chronic knee problems that are tied to wear and tear of everyday use. Simple things like carpal tunnel. And these are diagnoses that we treat to help the everyday person with everyday problems that could make a difference in quality of life. What we, I think, bring to this area as orthopedic surgeons is a practice that has depth. We bring what we believe to be a very high quality of care. We pride ourselves in the ability to communicate with our patients, where our patients will feel as though they have adequate explanation of what their problem is and what their treatment should consist of and what their options are, because there are often options. We pride ourselves on ability to follow through and attend to the details that make a difference. And hopefully that shines through with results. And our strong desire is to get everybody back to the level that they want to be.
Our motto is keeping life in motion. That's our goal for each and all of our patients, is to keep them happy, keep them moving, keep them pain-free, keep them functioning at the highest level that they possibly can. Patient care comes first. All other considerations are secondary. We have offices currently in Queensbury, Warrensburg, Ticonderoga, Granville, and Greenwich. And each of us is responsible for one of those clinics, so we share our time between the Queensbury office and a satellite. We love our work. We love the patients, we love the challenge, we like the science behind it. Mostly what we love is the outcomes. Patients are delighted with the outcome of their hip replacement or their knee replacement or whatever surgical procedure they happen to have had. We're even taking a patient who's scared and in pain from a fracture and be reassuring and get them in a cast, and even if you don't operate on them, treat them non-surgically, but they get better, they're back to normal, they run, they jump, they get back to their previous level of sports, and that's enough to keep you coming to the office in the morning, even if you couldn't earn a living at it, because you can just take people who aren't walking or aren't happy or in pain and make them better.